All right. So once again, a very warm welcome to yet another episode of Empower Hour by the Association of Nurse Executives India. You are aware that this is an association passionately created by passionate nurse leaders of the country. We are growing every day, and we hope those who are passionate giving back to the fraternity, giving back to the profession. This is one association you would like to join and contribute to strengthen the nursing profession. Thank you for joining. Just give me a moment. Let me share the screen and take you through some information. We invite the team over here. So friends, this Empower Hour in 2023 is all dedicated to from errors. And that is what we have been passionate towards. And the education committee of the association has 100 safety events. And these events are now being picked up one at a time. And one state chapter will discuss on that particular event in that month. This month, this is being hosted by West Chapter. I must say a very special chapter head, Madhumita Ray and Madam Dolly Biswas for supporting us with such a short notice, and they are willingly coming here. The chapter, Punjab chapter, was supposed to hold this month. Unfortunately, they had some logistic issue, could not happen. So I requested Miss Dolly, and very willingly she joined us. So that's why we are here today. And we'll tell you about the event in few minutes time. But before that, so that's our officials for this year, 2023 to 2025. Miss Captain Nair, Annie National President, Dr. Ulmuna Borgohain, Annie National Vice President, Miss Vinci Tribhuvan, Annie National Secretary, Lieutenant Colonel Dr. Aji Kale, Annie National Treasurer. They are holding forth from this year. And this is being showcased all of you for the officials of our association. The next, I would like to take a few minutes to tell you about this major event that Annie is going to host in Hyderabad. Last 2 years, ANICON 2021 and 2020 held virtually. We had tremendous success, almost 5,000 plus people, and nurses and students and other healthcare professionals have joined an array of, good speakers. This time it is going to be in person with the theme Transformational Leadership Towards Futuristic Healthcare, which is kind of in tandem with the Nurses Day theme as well. The Nurses Day theme is Our Nurses. So if you want to know more details about this, you can always go to the website. I will show you how does the website look like. So there the website is coming up, and that's our website. And if you click on ANICON 2023, you can see of the conference. You can see that where it is held and what are the tracks which are available, what are the competitions. The registration details will be out, but it is by 1st of May. So, so that is where it is. Let me go back to the presentation. So that is that's about transformational leadership. We hope that more of you join us in Hyderabad and make this event a huge success. We do have limited seats in the auditorium, and we hope once the registration is out, those who are willing to travel and have an experience of a leadership conference, you're welcome to Hyderabad and join us. So the next one, I just want to tell you about pre-conference workshop of ANICON 2023. So this is being held in collaboration with Ladle Medical, the simulation mannequins manufacturer company. So we are calling it simulation efficient. It's a hybrid workshop. That means you have to spend about 8 hours learning what is simulation and the principles and the thoughts around it, how to make it more practical. That will be on 19th and 20th May, 2 p.m. to 6 p.m. That will be online. And the hands-on workshop is on 25th of May, 8 a.m. to 6 p.m. So altogether 15 hours is what you need to invest. And let me tell you, from my own experience, we have put together something really a learning experience for those who attend the session. And hopefully you will go away with a lot of ideas that what can you do in your own college or in your own hospital setup where you have maximum simulations or you have minimum simulations. That I can promise you're going to have a great experience. Challenge, we can only take 25 people into this. It's a hands-on workshop. They will be working online also into breakout rooms, discussing, actually working on how to prepare for conducting a simulation scenario. So it is limited. So we hope to have 50% seats from college faculty and 50% from nurse educators. And since we have 13 chapters, so we are saying that we'll try to take 2 people from each chapter. The registration, the requirements, the nomination, the names have started flowing. The only contact point is me, that's my name. You can get in touch with me. What is required is that first you will decide whether you are an ANI member or not an ANI member. The cost will differ based on your membership status, though even for a non-ANI member, this is not very costly. Very sure of that. So on the right hand side, you can see all the what is this program all about. And we have 2 more ANI members who are joining me to facilitate this experiential learning workshop. That is Ms. Harita Nair, who is the nursing director for KIMS Hospital, Secunderabad. And we have Dr. Shain Anil, who is the nursing director for Jupiter Hospital, Mumbai. So 3 of us, along with the faculty from Ladle, will be facilitating the entire workshop. So I'm not going to say anything more about it. So if you are interested, you have my number and my name, you get in touch with me. I'll help you to see that how you can register for the pre-conference. So thank you so much for all of you for being here. Now, let's get back to the business of today. The business of today is to discuss the event today. So it gives me immense pleasure to invite the panelists for today from West Bengal ANI chapter. Ms. Doli Biswas, Secretary, West Bengal Chapter, ANI. She's also the CNO for Fortis Hospital, Anandpur, Kolkata. It's such a short notice. She's bringing with her her own team. Thank you so much, Doli, for listening and rising up to the occasion. I know that you have too many things on your plate, yet you agreed that, ma'am, I'll make it happen. Thank you very much and a very warm welcome. We welcome Ms. Banrishisha. The next word I can't even pronounce. Welcome. She's also a member from the West Bengal ANI chapter. She's the quality head for Anandpur, Kolkata. Let me request Banrisha your video on. A very warm welcome. Next is Ms. Purva Das, whom I have known for quite some time because she's also the ANI's patient safety fellow. So I have known her. So she's also a member of ANI and she's an educator at Fortis Hospital, Anandpur, Kolkata. Then we have Ms. Maumita Saha, quality nurse from Fortis Hospital, Anandpur, Kolkata. So we have the team from Fortis Hospital, Kolkata. And today, what we are going to discuss, I'm just going to show that, and then I'm going to hand over the entire thing to the team who is going to discuss. So Kolkata team, you seem to be very influential. We already have 150 people in the audience. That's a record. So that shows your influencing power. Thank you so much for that. So the case today that they are going to discuss is a 2-year-old child who was admitted to the adult ward because they had no beds in the pediatric ward. The prescription was to administer 200 milligram of injection paracetamol 8 hourly. And I'm very sure that all of you know how it is to be given. A side nurse connected the injection paracetamol strength of 1000 milligram in 100 ml, because that's adult ward, through the infusion pump and went to the patient as usual. After 1 hour, when she returned back to check, she found that the whole gram of injection has already completed. Immediately, it was escalated to the doctor and the patient was given antidote. So this is the background. And let me tell you where we got this case study. This is also important. 100 events have been collected by Education Committee of Association of Nurse Executives India, headed by Dr. Rosaline Rachel, and there's a lot of people who are supported, a lot of contributors, and a lot of work is being done behind the scene to look at the event, put it together, what we learned, what went wrong, and hopefully during ANICON, we should be able to release a book. We'll make some commitment. This is the book that is going to be released, which is going to be a huge learning opportunity for all nurses today and tomorrow, because we believe when something happens, let's admit that mistake, let's reflect on the event, let's learn from the event, and let's commit to do the right things in the future. So that is admit, learn, and commit. And this is what our team is going to help us with. So I will stop sharing the screen, and let me tell everyone that please make sure that you are staying muted and you're off video. Just give me 1 second so that I can pin our team members on the screen and you can have a better experience of seeing the people who are discussing. 1 second. I'm sorry. Okay, where is Momita? I can't see.
Yes,
okay.
yes, ma'am.
All right, thank you. So there you are, Dolly, over to you. Now I stay off the video and off the video. Thank you so much and all the very best, and look forward to your interactions and to learn from your innovative way of discussing the event. Thank you very much. All the best to all of you. Thank you.
Thank you very much, Madam Tankham. It's been a privilege to conduct Empowered Hour session on behalf of ANI West Bengal Chapter. And I am grateful to Madam Tankham for designing such a Empowered Hour session on every month, and every states are contributing and conducting the session. Thanks to all the participants, those who have joined today from various parts of the India. Thank you very much, ma'am. As Madam has already introduced with all of us, I would like to now request Momita. She will be starting the role play, and with this today's role play and the discussion, you hope that you will be enjoying the session. So Momita, over to you.
Sister.
Dear, can you please wait for a while? I'll be back to you.
Actually, sister, I need to share very important thing with you and very urgently.
Okay, Momita, tell me.
Actually, sister, I have done a big mistake for the 2-year-old child.
Okay, Momita, calm down and come with me. Explain me now what happened.
Actually, sister, that 2-year-old child supposed to get 200 mg of injection PCM, but by mistakenly I have connected through infusion pump and went to check another patient. And after 1 hour, when I came back to check, it was found all 1000 mg gone to the child.
Oh my God, what are you saying? You have committed a medication administration error. Is this baby okay now? Have you checked the vital signs?
No, I in a hurry, I did not check. I'll check the vital signs now.
Okay, Momita, don't panic. You just go and check the vital signs now. I'm informing to doctor. Okay. Hello, doctor. I'm Sister Purva. in charge of 9C adult ward. Actually, I'm talking about the 2-year-old baby was admitted with fever. Actually, the allocated staff has administered 1000 mg of PCM instead of 200 mg. Yes, pardon, doctor? Okay, injection acetylcysteine to be administered as antidote. Okay, doctor, can you please come and write down the order? Then I will prepare and administer the medicine. Momita, have you checked the vitals now?
Yes, sister, I have checked the vitals. It shows the baby is fine. Vitals is showing okay.
Okay. Doctor has advised to administer injection acetylcysteine as antidote. You will come and write down the order. I will prepare and I will come to administer the medicine. Okay.
Okay, sister.
So, Momita, can you realize what have you done actually? Have you checked the medicine before administration, the dose of the medicine, especially with anyone?
In a hurry, sister, I did not check the proper dose.
Oh my God. Actually, we will need a proper explanation of this April incident. Please come with me, Momita. We have to go and meet our chief nursing officer now.
Okay, sister, I am so sorry.
Okay, let it be. We have to talk to ma'am. Good morning, ma'am. May I come in?
Yes, please.
Ma'am, actually, what to say? There is an incident in my department. Ma'am,
Yes.
actually, can you remember the baby, 2-year-old baby was admitted in our department with fever?
Yes, I have seen during my round today.
Yes, ma'am. The incident is happened with the baby only.
What has happened, Purba?
Ma'am, actually, doctor has prescribed injection PCM 200 mg, but Momita was in allocation today and she has administered 1000 mg through infusion pump. Anyway, we have managed the baby. We have checked the baby. Baby is safe. We have informed immediately to doctor, and doctor has advised for antidote injection acetylcysteine. We have prepared the medicine and have administered, and the baby is under observation now. But ma'am, this is a big medication administration that has happened.
I got your points, Purba. So you have given already antidote. So first, let me talk to Momita. Hello, Momita. You are the allocated nurse for the 2-year-old child.
Yes, ma'am. Good morning. Yes, ma'am.
Hello, Momita. Good morning. So today, have you taken your lunch? Have you taken your lunch?
Yes, ma'am. I have taken.
Are you comfortable?
Yes, ma'am. I have come.
Are you comfortable now?
Yes, yes, ma'am.
Okay, Momita. Could you explain me that how you have administered the medication, that is the paracetamol, which is written as Purva mentioned 200 milligram, but the 1000 milligram you have administered. Could you please explain the process of administration that you have done in your unit?
Yes, ma'am. Actually, doctor prescribed.
How you have given?
Yes, yes. Actually, doctor advised to give 200 mg of injection paracetamol to that 2-year-old child. And I went to patient bedside and I have taken 1000 mg of injection paracetamol, and I am honestly speaking, I became so confused between syringe pump and infusion pump, and I have taken infusion pump and set the rate of 100 ml and putting the line to the baby 2-year-old child, and I were to check another patient's round.
So, Momita, when are you first time allocated for this 2-year-old child? Your ward is a adult ward, right?
Yes, ma'am.
But you have received a pediatric child, 2-year-old child in your unit. This is the first time you are taking care of a pediatric patient?
Yes, ma'am.
Oh, you haven't taken care ever before, right?
Yes.
Okay, so as you have said that you have administered through infusion pump, did you cross-check the medicine with your colleague or with your in charge before administration?
No, ma'am. I was so hurry, so I did not cross-check with my in charge or my colleague.
So you did not cross-check. the medicine, and first time you are giving, you always habituated of giving 1000 milligram of paracetamol, and you did not cross check. So did you realize your mistake, where you have gone wrong of administration?
Yes, ma'am, I am realizing my mistake.
Can you tell me that what you have realized, how this medication administration error has committed? Did you realize, and can you narrate it?
Yes, ma'am. Whenever I need to do a medication or administration process, so how much busy I am, and this is not a matter. I had to cross check with my colleague or senior. After that, I had to administer the medicine. This was my mistake.
Okay.
I did not.
So while you are checking, what are the points that you have to remember while you are cross-checking the drugs? Can you narrate?
Yes, ma'am. I have to check the right patient. I have to check the right drug, right dose, right route, right timings. After that, I have to administer the medicine to a patient.
Okay. And also you should not forget to check the patient identity, and you have to take the medication administration card where the medicine is written and the order of the doctor where he has prescribed in his progress note. Both has to match, and then you have to cross-check the medicine with the card. And if you have any sort of doubt, you have to clarify with your in charge. That you have understood where you
Yes,
have gone
ma'am.
wrong?
Yes.
Okay. So have you noted in the incidents form, the incidents which has occurred?
Yes, ma'am.
Right. So, Momita, once you have realized it, so what is your takeaway with this medication administration error?
In future, I will always cross check with all the medicine to my senior or my colleague.
Absolutely right. So cross-checking has to be done. And once you are handling first time a pediatric case, you need to be over-conscious. You need to check it if needed thrice with your senior, with your colleagues before administration, which pump to be used. It is a syringe pump or it is an infusion pump that need to be used. So you need to understand from yours in charge, from your senior. If needed, you can clarify with your doctor as well. All right, Momita, thank you very much for your understanding. I know that in future, you will never do such kind of error. Now, I would like to ask Purba. Purba, as in charge, did you clarify with the pediatric nursing in charge in pediatric ward before receiving this patient whether there is any bed available, because your ward is an adult ward, and how often, by the way, how often you are receiving pediatric patient in your adult ward? Can you explain, Purba?
Yes, ma'am. Ma'am, actually, we are receiving twice or thrice in a month the pediatric baby in our department, and only we are taking the baby once the pediatric ward is full, and the information actually we are getting from the bed managers. So this time also.
Okay, so this time also bed manager inform you, but you did not cross-check once again with the pediatric in charge whether she could manage any bed to take this pediatric case in pediatric ward, because your nurses are not trained. But as you said that you are in a month 2 to 3 times receiving a pediatric cases in adult area, which is not supposed to be. So in that cases, did you check the competency of your nurses? Anytime education team?
We are doing competency assessment, but this time, the last time we have missed, we are doing, but till now it is not completed, ma'am.
Why I am talking about the competency, because sometime you appoint a nurse who may have a pediatric exposure from other hospital who is working with you. So before allocating a nurse for a pediatric case, in case you have received the bed is not available in the pediatric unit, so in that case, you as in charge of your adult ward, it is your duty to understand the competency level of your nurse. And if a pediatric nurse with pediatric experience available, then you must allocate that particular nurse to this 2-year-old child. And second thing I would like to mention, as you are in charge of the department, and this pediatric patient who has arrived to you, you should have been little more conscious to instruct Ms. Momita, who is the allocated nurse, that before administering any drug, you cross-check with me. This oversensitivity is required as in charge of the department to inform to your allocated nurse, look, because she is in a hurry. She is having 5 to 6 allocation in a ward. So she may miss. But you as in charge of the department, it's your responsibility to understand the competency. Second, be conscious to inform her, cross-check the drugs with me before administration and understand that whether she knows or she doesn't know, right? Third thing I would like to say that, as you said, you are receiving 2 to 3 times in a month pediatric case. So you select your few competent nurse and train them with the pediatric processes and the protocols. Do you think so? Am I right?
Yes, ma'am, I should do this.
Yeah. So get the pediatric process and protocol with the quality nurse, with the quality head of the hospital, and sit with your pediatric in charge, understand that how they are administering the drugs, make the list of the drugs, the administration process, and put it in your soft board. Teach them, this group of nurses whom you are selecting, to get trained with the pediatric procedures, pediatric drug administration. So the written SOP, the formulas are in place, the nurses are ready. This is your duty to keep your department safe. With doing all these things, you will make a group of nurses to be fit to receive the pediatric cases, and you can avoid such kind of adverse event in your hospital or medication in your department. I hope that you understood.
Sure, ma'am, I have understood. Such an incident will never repeat, ma'am.
Yeah, so you have to be very, very conscious and you have to make the process right. Now, let us call our quality nurse. Let's get from her that what is her opinion and how can we take further step to avoid such kind of incidences in future. So can I call Bandisisha? She is the quality nurse of the organization. And Bandisisha, you have got through the incidents, the problem that has happened, the medication error the child has encountered, the antidote has been administered with the doctor's written order, the child is safe, vitals are absolutely normal. Now would like to hear that how can we improve our processes so that such kind of incidents should not be happening or should not be repeated.
Thank you, ma'am. I have heard all the incidents and it is very unfortunate, but still there is scope of learning from the incidents and errors. So I would like to mention to everyone that medication error prevention is the fundamental in every organization and while taking care of a patient. So we must take care of this. We should ensure the preventive measures in place. And especially while handling the pediatric patients, we should be more careful because they are the high-risk group, and we should treat every medication of a pediatric age group child as like a high-risk medicines, especially when the child comes to the adult ward where the pediatric child are not being handled by the staff. Ma'am, you have already mentioned that the competency of the staff is very important, but I would like to say also that if a medication error happens, it rarely occurs because of a failure of one single effect. It is a failure of the system. There is a failure in each and every check, and it is not only because of the staff nurse who handle the patient. It is a failure of everyone. It is a failure of the organization and the team that we failed to have the proper check in place. So as a team now going forward, we should understand and we should have more proactive risk assessment to identify that like we already have a dedicated pediatric ward, but sometimes due to the shortage of bed in the pediatric ward, like Purva mentioned, that the patient do come to her area. So we as a team should have a plan, management protocol in place to, if such kind of patient goes to her area, there should be a protocol and policies in place. And we need to talk with the pediatricians to have his suggestions, to have his clinical pathway, and those clinical pathway protocols and the drug calculation, which is very important. We should have readily available, accessible to the staff so that they can refer to it. And what is more important, that in pediatric ward, we know that the staff are frequently trained on how to handle the pediatric child. But in these adult wards, where the competency of the staff is lacking, so we need to identify those staffs. We need to have a regular training for them, so that like Purva mentioned, that every month 1 or 2 pediatric child do goes to her ward. So we have to have a backup and a competent staff who will be able to take take the allocation, and will have a minimal error in those areas. And so the training program should be more frequent in those areas also. And the education team has to have a competency check with the in charge of the unit. Only those competent staff will get the allocations of those child, so that we can prevent the errors in future. But having said that also, we must also ensure the bed management team, that whenever they send the child, they should send to those areas where we have competent staff, not to send in other areas where we don't have competent staff. So it is a responsibility of everyone. We have to give a reminder to a bed management team that if such kind of patient goes to their areas, they have to give alert to the chief of nursing or to the supervisors on duty. And like ma'am, you have mentioned the cross check. I would say that if a pediatric child goes to the adult ward, those medicines should be kept under the supervision of the in charge. They can keep like a high risk drug under lock and key. And whenever the staff goes to take the medicines, the key is with the seniors. So that time only they can have a check to prevent the error. Because sometimes with the juniors, we can understand the psychological factor when they are in a busy, their mental status is not stable. They are running here and there with the allocations, with the rounds, so they may miss. But if we have this check system, and we could have prevented this error. So in future, we can implement this. And one very important point also, we can keep this is keep educating the patient family. If the family is well aware about what his or her child is getting, then they can also have a check with the allocated nurse that what drug my child is getting, at what dose he or she is getting, so that before the nurse administer the medicine, the patient relative are well aware in advance. And that because nurses carries a big responsibility to administer the medicine, and once the medicine reaches the patient, it is very difficult to take back. Like we have seen this incident, we need to give the antidote, and what is the effect on the patient body, we may not know. It may have caused a serious harm, or maybe later in future there is a damage. But the responsibility, the big responsibility lies with the allocated staff, because once administered the medicine, the effect will be there for the patient. So we have to involve the family members in this. So this is my few points from my side, ma'am. And I think if we have this in place, we will be able to prevent this in future.
Thank you, Ms. Bandri. So, dear participants, you have seen the incidents, you have seen that how we have handled the medication error which has already happened with this 2-year-old child. So, often it has been seen that wherever there is an error, the allocated staff who is actually received the allocation are always in charge, from the in charge end or from the chief of nursing end. The pointing to that particular staff that because of our mistake, the error has happened. But if we really go in deep, or we do a deep RCA, a deep dive into the incident, we will understand that where all the points where we failed. So that is actually called failure mode analysis. And if we do the failure mode analysis, we'll understand that it's not a single person who is actually administered. We know that the person is responsible, but if a person has administered, she is not only the person who will be getting a punitive kind of actions will be taken on her. That should not be happening from any end, be it a chief of nursing or a nursing superintendent or from an in charge. That we have heard that cutting the off or certain some kinds of assignments being loaded. So yes, that and all, if a person is thinking that this is some sort of a punitive action taken on me, and the person will be demoralized. So what we do, we have discussed over here very positively. We try to find out the solution of that. Further, these kinds of errors should not be happening. So once we do the analysis of the entire event, we can understand, number one, that receiving a pediatric patient into an adult area should not happen. But sometimes some of the organization or healthcare sector, due to the bed numbers in pediatric, but sometimes it is less, or due to the lack of beds, we may have to receive the patient. But we need to understand that the in charge, whether have done the competency assessment, whether have selected the staff who is having some knowledge to handle the pediatric cases before. And it is also responsibility of the adult areas in charge to communicate with the pediatric in charge, whether she can manage to take the patient in a different way. And also the in charge nurse has to take an understanding, or has to understand that how much medicine to be administered to the pediatric patient. So accordingly, she has to be overconscious, and she has to handhold her staff who is giving. Maybe she is receiving first time pediatric case, the case which has happened, you have witnessed now. So it's very, very important to handhold the allocated staff, understand, cross-check, and administer the medicine. So be with the staff, give her a support so that this kind of error can be prevented. Process, protocol, policies, formula, everything, calculation of dosage needs to be trained by the education team, quality team, and by the in-charge supervisor of the department every time. So this training, unless we upgrade, unless we take the effort to upgrade the nurses with knowledges, with the skill, we will never be able to achieve excellency. We will never be able to achieve patient satisfaction, and such kind of error will be evident. So we all have to work together to get the success. And that is what is the mantra, that is what is our, the process that we need to take care of, and it needs to be in place. And this is the entire incidents where the child is safe, but it has happened, and the quality nurse will get the incidents report once it has been narrated by the staff in charge, endorsed it, signed it, and it will come to the quality head and quality nurse, and then the analysis will take place and it will be reported. So reporting is very, very important. If we use some kind of harsh word to our staff or a punitive action, the error will be submerged. The error will not be coming ultimately, or will not be able to take any actions to reduce the further error. So we should not create a very kind of harrowing environment in the organization that errors are not reported. We always encourage, even the near misses has to be reported, any error has to be reported. If there are reporting system are very strong, we will minimize such kind of incidents because the process, protocol, and everything will be in place, and training has to be ensured to the staff. So this is, I think I could enrich with these incidents. Ma'am Tankam, if you would like to add up anything, ma'am, you are most welcome.
Thank you. I'm right here, and I was listening to all of you. So thank you so much. You have put it in a very interesting manner, in a role play manner, and you have kind of showcased everything
Yes.
that needs to be addressed. And I would like to summarize how you have put it all together. So I'm going to use all of you, and also
Yes,
maybe
ma'am.
become
Sure.
part of the role play and say, so Momita, so I'm just going to ask you a couple of questions to say that, when you are in an organization, and if you feel that you don't need to fear about telling a mistake that happened, you think that the staff nurses will be more free to report?
Yes.
Yes, Momita?
Yes, ma'am.
Yes. Okay. Don't worry. I'm not going to question you anything more. Don't worry about that. Relax.
No,
After
ma'am.
all, it's a role play. So we are
Yes.
trying to say, so that is one very important learning that we all had, was that I could see, uh, when when Momita was reporting, I was watching the, expression of Madam Dolly. She was like, almost like, oh my God, what happened? This mistake happened. It was also, it was as though it was really somebody was, I can imagine the emotion if I am the nursing head when someone tells me that this error has happened. So obviously, there's a lot of emotions that come within us, there's a possibility that you may just kind of react. Purva also said the same thing. Oh my God, that's a natural expression. It's okay. You are not trying to scare the person. You are trying to say, oh my God, it should not have happened. That's
Yes.
fine, perfectly fine. But then you held your calm. You did not shout at the nurse. You did not say, why didn't you ask me? Why didn't you do this? Why didn't you do that? I did not hear that in your role play. And that is exactly what is expected from all the organizations. We tend to react, and the famous saying, to err is human, I understand, but that does not mean it gives us the privilege to make mistakes when we could prevent it. So we should always try to prevent the harm by doing whatever is right. That's what Dolly has been trying to summarize throughout the session. So Mamita says that as a staff nurse, if she feels that she's safe to report, she will report. But if she's afraid that Purva in charge like Purva is going to eat her, or a nursing head like Dolly is going to eat her, then she will say, how can I hide it some way? Because I am going to be, shouted at, cross-questioned and made miserable. And it will look as though, I did my mistake intentionally. So this entire episode that we are trying to showcase it called Learning from Event. So we are looking at something that happened elsewhere and trying to learn, so that all of us, whoever is in the audience, whether you are a staff nurse, whether you are a student nurse, whether you are an in charge, whether you are a quality nurse, whether you are a nursing head, there is something for each one of us to learn. Every time I sit through the Empowera, I am reiterating what I knew and what I would like to learn. Few things, sometimes some thought comes, okay, maybe this is how a nursing head should summarize. This is what we are going to do, right? And every chapter they comes with their innovative way of discussing, and the base is almost like a role play. That you are creating roles. So you had a staff nurse, you had an in charge, you had a quality nurse manager, and then you had a nursing head. And in sometimes we also have a group head, trying to see that what processes needs to be. I really liked when, Purva told, okay, now this happened. So let's now inform these, but she did what was important to be done. Take care of the patient first. She did not tell Mamita, oh my God, write your incident report. And then you go and take care of the patient. That expression is good enough for Mamita say, next time I'm not going to report. Look at her face, But
True.
Purva had a nice, calm face, and she said, oh my God, but it's okay. Let me talk to the doctor. Let me fix the problem for the patient first. So the patient got the antidote. And again, I liked when Purva said, we will give the antidote, but I will come and give it. She is not trying to tell, she knows that right now Mamita is under a lot of stress. I cannot give her one more responsibility immediately.
Exactly.
That may not be fair. So she's, instead of telling, this dialogue can also happen, no? I spoke to the doctor, he told me the antidote. I cannot trust you to do the right thing, no? Wait, I will come and give it. The entire scenario changes.
Absolutely.
Mamita's confidence shatters. She says, I should not have reported. She may not think what could happen to the patient. There is a possibility. We are all humans. When somebody is, reacting and shouting at us, the human tendency is to push back and say, I don't want to be there, right? Lot of repercussions can happen. But very calmly, Purva said that, okay, I talked to the doctor. He will come and write it down. I will come and give the antidote. And then, of course, you have to go to the CNO. It does not mean because it's a role play, it's a virtual scene. It does not that same day, same time you're going to the CNO. It's not like that. You will settle the patient and possibly Purva will just phone her and say, ma'am, this is something that has happened. I am taking care of the patient. And, can I come and meet you along with Momita after duty? During duty time, you don't put somebody up. Oh, okay. I will tell you one story that happened with me many, many years ago, but I learned a powerful lesson. This was as a nursing student, I was supposed to give mouth care. In the early time, you learn how to give mouth care, put soda bicarb, salt in a tray and all that stuff. Okay. So the assigned nurse, I was given to a senior nurse, and the senior nurse told me, give mouth care to this patient. Okay. So I went with my tray and everything very diligently. I am going there to give the mouth care. And this patient, very thin, and he's already propped up. So I know this patient is propped up. So I am going to give the mouth care. I started giving mouth care, but I did not realize that this patient is gasping. Me as a new student, I had no idea this patient is gasping. And somewhere when I was giving mouth care, he stopped breathing out. Even that also I did not realize. Okay. I am continuing. His mouth remained open. So I'm giving mouth care. Then the in charge came and she saw the patient has gone. What she did not shout. She didn't do anything. She said, child, come out. And I started seeing people running to the patient. So I thought I killed the patient. This is the real story. Yeah? I killed the patient. I started crying. I said, oh my God, I did not kill the patient. I'm just 17 years old. Huh? I didn't kill the patient. The in charge told me, please go and sit down in the linen room. There was no staff room. She said, pull a chair and sit there. Don't come out. Then she was attending the patient. Okay. I don't know what happened. But what happened later is a powerful message to all the leaders. She came to the linen room. She talked, she sat with me. She pulled another chair. Then I said, sister, I didn't do anything. She said, you did not do anything to the patient. I am sorry. It is our mistake. The senior should not have given that patient to you without explaining what needs to be taken care, because you are not yet been trained on the assessment, realize the patient is not breathing. So relax. It's okay. It is my fault. In charge was telling, it's my fault. I should have seen that you are not ready to give mouth care to such a terminally ill patient. And she said, one more patient would have anyway died. Whether you gave mouth care or you didn't give mouth care, it's not your fault. So don't carry this in your heart and head. You are designed to become a great nurse. Focus on it. Next time, I will tell my senior nurses, don't put students just like that. Explain to them who is this patient, whether they can give this mouth care to such a ill patient or not. So I still remember that scene. I still can see that in charge. And I always carried this story with me, because as I became senior, I realized somebody did great thing with me. That day, I could have finished my confidence as a student nurse, telling that I'm a very bad nurse. But she gave the confidence back to me. So I'm sharing this story with all of you to say that it's very important that each one of us, in our own role, whether we are in charge or a supervisor or a quality manager or a CNO or a group head, to understand that there are a lot of human factors involved when something goes wrong. And that was very well summarized by Vandrisha when she said, it is not the person, it is the system, it is the process that we need to look in. So this is very, very important. How can a process and system be looked into if the person involved, Maumita, for example, she did not even tell. Child could have suffered. the worst of the adverse event that can happen with the overdose of paracetamol, correct? So knowing in theory the overdose of paracetamol is no use when you have not taken the safety measures when you are administering a unknown category of patients. So the problem was Momita was used to adult patient. So that's what Dolly told Momita, that when you don't know what to look after in a pediatric patient, as a nurse, all of us know there is a difference between adult and pediatrics. So at least I should tell Purba to say, ma'am, sorry, I have not looked after children before. So please check, I'm not very sure if I'm doing the right thing. I always used to tell my nurses, I don't expect you to know everything in the world. I don't expect you to do everything in the world. But when you don't know, please ask for help. That's all I am asking. If you don't know, don't do it. If you don't know the medicine, if you don't know the dose, don't do it. Nobody will come after you. But when something results in patient harm, somebody is going to talk to you, not somebody, many bodies will talk to you to ask that what happened. And you start to think that, oh, I am put on a cross. It's not like that. In this scenario, you saw that everybody is calm, everybody is respectful, talking to each other. This is what is required in real scenario. In a virtual world, it's very easy to remain calm and discuss because you. But in real world, when something like that happens, all the nurse leaders should be aware our adrenaline will go up. Yes, as a nursing head, sometimes I used to say, where do I go and break my head? What did this? I want to break my head because this happened. I cannot forgive myself that under my eyes, something like this happened to a patient. I cannot forgive. It takes me time. So I usually used to tell myself, Tankham, take a deep breath. It can happen with anyone. So be kind, be kind, be kind. So first thing I'll say, okay, let's look after the patient. Look after the patient, settle, and then we'll say, okay, everybody take a deep breath. Let's now sit down. So Dolly will probably call everyone after the duty hours and say, all right, let's see what happened. So that's what she was trying to talk to Mamita and Purba and then to Bandrisha and quality. As a quality manager, Bandrisha was taking responsibility of setting the process in place so that next time, one is to make sure the pediatric children are not put in adult at all possible. You may have to transfer out somebody, put somebody. So it's almost like, managing a ICU. So when you have a surgical ICU, you want to have all surgical patients in that ICU. You will not blindly put someone in medical ICU. You will start to think, can I transfer out someone and put this patient there? Correct? And doctors also don't like to mix up all the patients. It's because the nurses who are working there, they have the competencies to look after the patient. Correct? So Dolly, coming back to you, I really like the way you were very patient with all and summarize all of it. And I really hope that we have still got 200 people here. All of you have learned something from this entire episode. So thank you, Dolly, Bandrisha, Purba, Mamita, and the entire participants, because all the people, 200 plus people were here. And someone even left a message to say that, they really like the format. I just saw the message coming in. Enacting the incident kept our focus on the session. Thank you. That was really good. So again, it is validating the way that we are discussing the case. It is not like putting PowerPoint and, talking about, So this is the way that they can feel, oh, I can do this. I can do this next time, So I usually used to tell it as a joke to say, please don't shoot the nurse. Please don't kill the nurse.
Absolutely.
That is not the answer to an error. Just killing the nurse is not the answer to the error. It does not make us any more safer. So all this empower hour that we are discussing is only to ensure that all of us, all the audience who are sitting here, all of us are able to practice very safely, right? Thank you so much for all of you. I added a little bit more, just picking things from there. And next month, we are going to have another episode of Empower Hour in which, let me just pull out the, that presentation for a minute. I will just remove all the pins if I can. and then, we'll be able to share very easily. So thank you, the entire team. Thank you so much. And you were all on the screen looking very beautiful. And I remove my pin also. And then now let me share. Okay, just give me 1 minute before we close that, recording and. Okay. So that's the team who has done the, this month's episode of Empower Hour. And this was the case that they discussed. Thank you so much. It was dealt with extremely well. And thank you to everyone sitting here for committing to patient safety. And Annie is definitely committed to patient safety. The next episodes are going to be in June. There'll be 2 episodes because May we are skipping because of Nurses Month and Anicon. This is going to be hosted by Northeast and Maharashtra chapter. We will keep you posted on the dates. And please do not forget, please do not forget your Anicon before you sign off. I just want to say, please welcome all of you to our flagship event, Anicon Transformational Leadership Towards Futuristic Healthcare. And I will now stop sharing. And I will, with a huge thank you, I will stop recording. And as usual,